Day 32 of the ongoing doctors' strike was laden with threats and lawsuits and ultimatums, with both the government and medics maintaining their hardline stances.
Well, today the Ministry of Health, through the Medical Services Principal Secretary, Kimtai, gave intern doctors 14 days to return to their duty stations. The Kenya Medical Practitioners, Pharmacists and Dentists Union, however, digging their heels further into the ground on the matter. Meanwhile, Inspector General of Police Japhet Koome faces a possible lawsuit over his comments on the doctors' strike, which has drawn in the Law Society of Kenya and other civil society groups. As the standoff between doctors and the government spills into a second month, both sides are showing no signs of ceding any ground. In the latest development, Medical Services Principal Secretary Kimtai gave intern doctors 2 weeks to resume their duties as the strike went on for a 32nd day.
Na kama wewe ni mzazi ambaye umeshughulikia mtoto wako university akawa doctor, tunaomba kwamba uwajulishe waende sehemu ambazo tumewatangazia. Wasipoenda baada ya siku 14, basi huyo ni ule amekubali kwa hiari yake kwamba hataki kuendelea na mambo ya kujifunza ya udaktari.
The Kenya Medical Practitioners, Pharmacists and Dentists Union, or KMPDU, Secretary General Davji Atela had this to say in response.
So there is no amount of intimidation, I've said before, or threats that will make those interns take exploitative contracts that has been gotten between SRC and Ministry of Health. That has to be corrected, and that's why that's part of the reasons why we are on strike. Issues that we have outlined have not been implemented, and therefore you should not try to threaten any doctor.
The pay and posting of medical interns has been one of the demands in the ongoing doctors' strike. In 2017, KMPDU signed a collective bargaining agreement requiring interns to be paid 206,000 shillings per month in salaries and allowances. The Kenya Kwanza government, however, came back with an offer of a 70,000 shilling monthly stipend that has been rejected by the union. Speaking in Chuka today, Council of Governors Health Committee Chairperson Governor Muthomi Njuki said the 2017 CBA must be renegotiated and warned striking doctors that they will take action as the courts declared the industrial action unlawful.
I will use the mandate I was given the people of Tharaka-Nithi. Those doctors, even if you're here, usiniangalia vibaya. If you're not back to work on Monday, which is tomorrow, I will have no choice. I will have no choice but to institute the process or the allowed HR process to replace you.
But in terms of respecting what you're asking for, every Kenyan agitates for a better welfare. Only that now our country is in a situation that we cannot afford too much. Si kusema hatutapea madaktari pesa, ni kazi yao kunegotiate. But as they negotiate, I'm asking humbly, turudi kwa kazi.
Inspector General of Police Japhet Koome had a less conciliatory tone as he addressed the striking doctors in a statement today, terming them, quote, a public nuisance, and cautioning them to, quote, refrain from infringing on the rights of others while demonstrating. KMPDU Secretary General Dr. Davji Atela said the threats by the IG undermined the doctors' rights to demonstrate and present their petitions.
Japhet Koome has no moral authority to comment on our demonstration, which is so peaceful. And yet, he has not said a word against the police officer who shot me. He has not said a word of the goons who attacked us on the street. So, is he there just to break the goons, or is there for the Kenyans?
The Law Society of Kenya, Katiba Institute, Kenya Human Rights Commission, among other CSOs, demanded IG Koome apologize and withdraw his remarks by 6 p.m. Sunday. LSK President Faith Odhiambo in a statement warned that, quote, should any unreasonable use of force be meted against doctors, the lawyers' body would take legal action to find the Inspector General personally liable. While also condemning the IG's comments, the Kenya Union of Clinical Officers mounted pressure on the Council of Governors to speedily conclude the collective bargaining agreement negotiations for clinical officers. For now, the wards in public health facilities will remain empty as the medics continue to fill the streets.